Welcome back, everyone, to Montgomery County's Engage at Home, brought to you by the county's Caregiver Support Program. Today, I've invited Sheila from the Alzheimer's Association to join us. Sheila, would you please introduce yourself?
Yes, thank you, Lily. Hi, everyone. My name is Sheila Griffith, and I'm the program manager for Montgomery County for the Alzheimer's Association. So our chapter is called the National Capital Area Chapter, and we cover not only Montgomery County, but Washington, D.C., Prince George's County, Northern Virginia, and also Southern Maryland. So it's quite a big chapter.
Wonderful. And you are such a good partner here in Montgomery County. So, June is Alzheimer's and Brain Awareness Month. Can you tell us more about what the Alzheimer's Association is doing this month?
Yes, and thanks for asking. And I hope everybody has heard about one of our fundraisers that we're doing this month at the Alzheimer's Association is called The Longest Day. So it took place on Saturday, June 20th, the summer solstice. And I don't know if you can see my t-shirt. I have my Longest Day shirt that I earned. So it's kind of our fundraiser in the spring where we ask people to do any activity they'd like for the month of June, now celebrating brain awareness, and just raise funds as they do that, maybe that fun activity. So one of the things I did was my family and I climbed Sugarloaf Mountain up here in Montgomery County. So we celebrated the summer solstice, the longest day, as well as Father's Day, because my husband loves to hike and do stuff like that. So I killed two birds with one stone. But it's a great month to think about brain health, brain awareness, and Alzheimer's and other dementias awareness. But of course, I'll talk a little bit more later about our big fundraiser, which is our Walk to End Alzheimer's that usually happen in the fall.
Thank you. And is there a website associated with this Brain Awareness Month that people could go and visit to learn more and how they could get involved?
Yes, thank you for asking. So if you can just go to our website, which is alz.org, and to really to see things more local, it's alz.org/NCA, which is National Capital Area. And you'll see things, actually you'll see pictures today on our website of what people like others like me who have what activities they've done over the weekend and for the month of June to raise awareness for Alzheimer's and other dementias. So alz.org/NCA. And if you'd like to see some of those really interesting stories on how people are trying to raise awareness, there's a Go Purple button. And so everything's in purple, but you'll see a Go Purple button and click on that and you can read some good stories, I think.
Oh, wonderful. Thanks, Sheila. So how is the Alzheimer's Association providing help to people with Alzheimer's and their family and caregivers during COVID-19?
Well, great question, and thanks for asking, Lily. Here in Montgomery County, we have about 10 support groups that were meeting in person, and we had one that was a virtual support group that met online. And we have 5 memory cafes, which are for people with a diagnosis. So the caregiver support group is mainly for the caregiver and the families to talk about what they're going through. And then these 5 memory cafes are for people with the diagnosis. So altogether about 15 groups. Prior to March, we all met in person. Then, you know, the pandemic hit mid-March, everything kind of stopped for us in person. And by the last week of March, we were able to transition our first memory cafe onto online. And so we had the memory cafe, the Rockville Senior Center Memory Cafe online. And it was just wonderful. It was bumpy at first, but everything followed afterwards. It was nice. So out of about 15 groups that meet at least once a month, some met many times in person, we've transitioned all but 3 of those groups to be virtual meetings online. So, and some telephone too. There are things that the telephone has worked better for some groups, but all but 3 have been able to transition. So we've really been thrilled with that. And although it's still challenging, I think a little more challenging than in person, but once you can get that virtual, the progress made to making a meeting virtual, we've seen a lot of benefits in it too. So that's kind of the silver lining to this pandemic for us here at the Alzheimer's Association in Montgomery County, is that we have been able to go virtual, and it's actually benefited us in several ways.
Thank you. Sheila, I know that you, your team, your volunteers, you're really seeing caregivers having to navigate such challenging times as we are all keeping our social distance. You must be seeing and hearing from folk who are really struggling with this. Could you tell us a little bit about what you're experiencing, and maybe what some of the ideas that you have that have been helpful?
That's a great question. And yes, there have been many challenges for caregivers and those with the diagnosis of Alzheimer's or dementia during this time. There are many services that people, caregivers and their loved one had taken advantage of, say, previous to the pandemic, maybe in person. Adult day services, a lot of different activities here in Montgomery County that seniors can be involved in. So since a lot of those went away, the in-person experience, the person with a diagnosis and their caregiver is left at home without those either small breaks or large breaks, and they're just one-on-one or within a family, and may be struggling. The person with the diagnosis might have had a lot of stability with their structure. Maybe Monday through Friday they went to an adult day program, or some variation of that type of schedule to keep busy and to keep stimulated. And then once you're, I think we all experience this, once you become isolated, and there was so much uncertainty for all of us during, I think, March, April, and May. It took a long time to kind of get a new schedule going and a new reality. But in that time, in some of our groups, we learned that the caregivers, they reported that their loved one maybe picked up more behaviors, or just seemed to go advance through the disease, before their eyes in their isolation at home, or have different behaviors that they weren't equipped to really, to respond to in some ways. And so our caregiver support groups seem to become even more important. Sometimes you had to struggle to get online and to find the right details for the meeting, and that's one of the jobs I had during the pandemic, and I still have, is really helping people get online and understand what platform we're using and what time we're meeting, and then clicking on the right link. But once they're there in our meetings, they became as valuable as an in-person meeting, maybe more so because of the isolation. We learned things, there are people that are struggling with all sorts of questions. One is behaviors. I see new behaviors in my loved one, and I don't know how to react to this. And so others in the group could obviously give advice, or one of the facilitators also could probably give advice. But even getting out, people who have a loved one with this diagnosis, with some sort of dementia or maybe Alzheimer's, they don't understand to wear a mask. They don't remember to wear a mask. They don't remember not to shake hands. They don't remember why we're not visiting the grandchildren. They don't remember why they're not going to their daycare program. So it can be very difficult for both the caregiver, these behaviors increase possibly, and the person with the diagnosis, because the stimulation is not there the way that it used to be when we were in person. So at the Alzheimer's Association, we have, our website is just wonderful. It gives you a lot of good information. during any kind of normal time about the disease. But now during the pandemic, we have a lot of tips and different ways to cope with maybe your loved one is home with you and you're continuing to care for them. Maybe your loved one's in the hospital and that can be very difficult. Or if your loved one's in a nursing home or assisted living facility and you can't visit any of these places and see your loved one, that can be very difficult.
Absolutely. And I think that this is an area where the Alzheimer's Association has just pivoted so well to acknowledge that caregivers need support. You know, COVID has disrupted how we connect with each other, but the Alzheimer's Association, through your virtual education, your support groups, your online and telephone supports, people need to be connected. And in some ways, that's the message that we're wanting to share with caregivers today, is that you need support maybe more than ever.
Yes, and I think there's so many ways that you can connect as a caregiver if you are experiencing any sort of stress or difficulty. One of the first things you can do always is call our 800 number. We have if you go to our website at alz.org, you'll find all of the information that I'm going to detail here, but you can call our helpline. It's 24/7, manned by social work level people who are able to help. That call will go to a central calling area. And if you're in Montgomery County and you have a question about some of our services here, and that's where you're calling from, they'll immediately connect you to me, to the person who is here. I'm the program manager in Montgomery County that can best have a conversation with you about what services are still going on. Now, when we're in person, it's a very robust and, the Montgomery County Caregiver website, all of the supports that we have online normally, that can be a very robust conversation. But maybe now it's a virtual. I need a support group. You don't have to be close to the location. I can just say to you, hey, there's a support group tonight. Would you like to connect to it? And we can talk through that and see how that goes for you. But the 800 number, the helpline, is a great way to start if you like. But another way to start is just on our website and seeing what's available as far as a caregiver support group or a memory cafe, or just to get in touch with me and have a conversation about maybe there are some next steps that need to happen. We also have a great opportunity within our Montgomery County Alzheimer's Association, our chapter here. It's a care consultation. So if things are a little more complicated than just a conversation with me about services or resources or connecting, we can always have a care consultation with one of my colleagues who is able to sit down virtually with anyone in the family. It could be even the loved one with the diagnosis, it could be other family members, and discuss whatever may be happening within the family unit, or also trying to discuss next steps of what to do in that journey, the Alzheimer's dementia journey. So yeah, I agree. I think that we really, I'm proud of the way that the volunteers who I have who work with me, I don't run all these groups, I just help them run themselves. And so I have a lot of volunteers who have stepped up. Some of these volunteers are all trained facilitators to facilitate groups like this, memory cafes or caregiver support groups. But those people have all just made the decision, the conscious decision, to continue to volunteer and to do it virtually. And many of them, this was not their comfort zone in March and April. I don't think it was any of our comfort zone in March and April, but now many people are very good at it and doing good work virtually.
Wow, so true. And I think that one of the things that I want to emphasize is that through the Alzheimer's Association 24/7 helpline, people can call any time of the day. And I think one of the things that we really want our caregivers to know, that we understand that sometimes the breaking point happens at 2 in the morning. And the benefit of actually calling a social worker through the Alzheimer's Association, it's enormous. And to be able to have someone step you through, you may have a loved one who's out wandering the house and you are at wit's end and you have said, I need someone. And what I like what you say is that 24 hours a day, the Alzheimer's Association has trained people who are there to help folk, but then they can then refer that family caregiver to, say, a care consultation or to you in Montgomery County. So then the more local work can get started.
Yes, and that's exactly, you said it in a nutshell. That is exactly it, and it does help. People tell me that they've tried maybe when somebody was first diagnosed, a loved one was first diagnosed, they tried the 800 number. They called to see what was this about, what could I, and of course everything is free. I think we hopefully we said that earlier, or I'll say it now. This is all free of charge, and so to make the phone call, just to get your bearings. Maybe you've just gotten the diagnosis. You're not really sure what it means. Maybe you just got the diagnosis and the doctor said, okay, come back in 6 months. Well, what do I do now? So this is a great way to get somebody to give you that sort of advice and to really help, chart what is going to be happening in the short term and also in the long term, but then help you get local too, and to be in contact with me for Montgomery County. We're very lucky because I think in Montgomery County and in our area in general, we have great services that sometimes you know about and sometimes you might not know about. And so it's great to be able to not only talk to somebody anytime, 24/7, but then also connect locally. And let me just say that that number is 800-272-3900. So 800-272-3900. And we welcome your call, obviously 24/7, for any help, any question that you'd have about Alzheimer's or other dementias.
Wonderful. And I'm going to include both the telephone number and the websites on Engage at Home. So Sheila, you're at the coalface. You are experiencing what caregivers and their loved ones are going through. What are you finding? What are you experiencing as being the most in demand and the most beneficial supports that the Alzheimer's Association is offering?
Well, one of the things we also do, I do as a program manager and several of my colleagues, are that we do virtual education programs. So we educate about Alzheimer's disease and other dementias. And we have many programs, but one of the ones that I'm doing more frequently than I've probably done it in person in the past is our program on behaviors, understanding responding to dementia-related behaviors. Because as I said earlier, I've been told through our caregiver support groups that with the isolation has come different behaviors by their loved one who has a diagnosis of Alzheimer's or dementia, or increased behaviors. Hardly any of them are decreased behaviors or sort of doing better. So I think the lack of stimulation does affect people, or the lack of a routine maybe has affected people with the diagnosis. So the caregiver going and registering for an education program, and they're on our website again, alz.org. And if you look up education resources, you can find programs that are taking place almost every day in our chapter and in other chapters in the country. But you can just log on, register, and then view the program. It's live often, and I think you get a lot out of an education program where someone like me is going through the program, but then you're also, just like in person, able to jot your questions down in the chat or just ask your questions, as the program continues. I'm finding that need more and more, my colleagues and I, that we're doing our education programs to very varied groups and groups that we've become involved in. And then the groups are asking us to do more education. So it's great. We're really happy, and we really feel like we're filling a need here for caregivers just to get a different perspective on what's happening with their loved one.
Thank you. And I've participated with a number of those, and what has struck me is that caregivers, irrespective of when the diagnosis was shared with them, oftentimes just haven't been prepared. They just always benefit from hearing that this disease has a pathway and that there are supports for caregivers, and the Alzheimer's Association has education, support groups, care consultations, all available as benefits to the caregiver.
You've said it very well. Thank you. Thank you, Lily. I think that if you are a caregiver, or if you're someone who's diagnosed with the disease, please get in touch with us and let us help you. Let us try to help you and connect you with resources that I think will be very valuable, as the pandemic continues, as we don't know, how long we'll be doing this. But one of the things we've learned at the Alzheimer's Association is that even if we are going back into in-person, either senior centers or whatever ends up happening within Montgomery County and in our area in Maryland and DC, I think we'll always still offer our virtual services. So virtual support groups as well as in-person support groups, and virtual education as well as in-person education.
Thank you, Sheila. So we've come to the end of our interview today. Any final thoughts that you would like to share?
Just want to thank you for having me on today, and to ask anyone who is experiencing this disease to please get in touch with us, and we'll definitely be able to help you. And if anyone even has a question about it, you had said earlier, Lily, is that you'll leave all of the information on this recording. So I invite you to get in touch with us any way you're more comfortable doing.
Thank you. And I will be including both the telephone number and the web links on Engage at Home and the podcast. So this has been our interview today with the Alzheimer's Association. Thank you for joining us on Engage at Home, and please stay calm and be well.